Welcome everyone. It is 1:30, so I'm going to call our meeting to order, and we'll start with our welcome and introductions. I'm Liz Sheehan. I am a council member for the 5th District. I serve on the HPI board, and I'm chair of this committee, and I will pass it this way.
I'm Jeff Herron. I'm the manager of LFECG's Office of Homelessness Prevention and Intervention.
I'm Adam Kuhn. I work with Jeff in the Office of Homelessness Prevention and Intervention as the HMIS data analyst.
I'm Marissa Webb. I'm the Continuum of Care Coordinator in OPI.
I'm Shannon Derrick. I'm with Passport by Melina, and I work with our
This one
housing
or
specialist.
along the edges.
I am Tracy Holmes with the Lexington Housing Authority.
My name is Derek Feldman. I'm new here with the Lexington Housing Authority.
I'm Tanya Christopher. I'm with the Lexington Housing Authority.
I'm Bruce Davis, member of the HPI board.
Ryan Geider, Independence Place.
Eric Evans, Housing Advocate, Independence Place.
Jamie Cody, I'm the Transitions Program Manager at Bluegrass Care Navigators.
David Shad, Hope Center, and HPI board.
Marty Jones, Community Action Council.
Sherry Pennington, Mountain Comm.
Christina Ellison, New Beginnings Bluegrass.
Sylvia Cassidy, Councilmember Sheehan Zaid.
Thanks. Go
I'm
ahead and
Chris,
introduce yourself.
with New Life Day Center.
And Diane.
Diane Fleet, OHPI Chair and Greenhouse 17.
Thank you everyone for being here. We have on our agenda, our next item is the approval of the meeting minutes for April 16th. Those were in your packet. This is a full membership vote, not just a board vote. So if you have any suggestions or corrections, now's the time to volunteer those. Seeing none, I will take a motion to approve.
I move approval of the April 16 board minutes.
Okay.
Excuse me, it's committee minutes, excuse me.
I have a motion from Bruce
I'll second.
and a second from Christina. Any discussion on the motion? All in favor say aye.
Aye.
Any opposed? Okay, that motion carries. Thank you all. Then we have a few program reviews today. We have Bluegrass Care Navigators with the Medical Respite Program. This is an ESR grant, is up first. So for all the presenters today, you have about 10-ish minutes to present and then time for questions. So I will start with Bluegrass Care Navigators.
Thank you. Like I said, I'm Jamie with our Transitions Program here at Bluegrass Care Navigators, and we operate the Medical Respite Program, which provides a very short-term hotel medical respite model to individuals who are have some acute or post-acute needs generally following a hospitalization, who because of those are not eligible to access existing emergency shelters, need some time to recuperate before returning to shelter or returning to other housing, or in some cases if they refuse to go to shelter, to the street. But hopefully our goal is to get them connected with temporary or permanent housing during their time with us. So we begin planning for safe discharge during that hospital stay or at time of the referral to make sure we have an option for a safe discharge. We accept referrals 24/7, 365, and provide case management during that time via our social worker. We also provide nursing visits as needed, so things like medication reconciliation, making sure patients get to their medical follow-up or treatment appointments, and also connecting them with any applicable housing services as well. Conduct some clinical assessments to further identify needs, and also make sure that patients are connected not only for their medical needs, but also for any mental health, behavioral health, substance use disorder treatment needs as well. Patients also have access to our 24/7 support line to reach medical respite staff if needed. We served 73 unduplicated patients in a calendar year of 24. 13 of those we served twice. Almost 7% veteran population. As far as race and ethnicity, minorities, we served about 34% minority population. and an average length of stay with us of 8.5 days, with 98% of those being less than 30 days. When we looked at where patients are going after medical respite, nearly 20% of them discharged to temporary or permanent housing. So based on that short length of stay, really glad to see that outcome, always working to improve that statistic. We did have almost 33% that went to emergency shelter upon discharge, and then about 7% who needed some additional medical or behavioral health services, either in a hospital, a psychiatric facility, or a substance use treatment facility, and we help make those connections. Nearly 25% self-paid for a hotel following discharge from medical respite. And then we did have 9.6% who declined shelter, were discharged either to their car or street. Like I said, our goal is always to get them connected somewhere, either an emergency shelter or other temporary or permanent housing. When we look at patients served, we had less than 3% who were removed for rule violations, and that was 2 clients who violated hotel rules. Generally, that is damage to the room, smoking in non-smoking rooms. We do try to give patients warnings and things like that, but we did have 2 who were not eligible after that. As far as completion rate, we had 94.5% of our patients complete their medical respite stay and their treatment plan. Those that didn't were the 2 that violated hotel rules, and then we had 2 that left without notice from the program. When we look at challenges of the program, we know there are a lot of individuals who have chronic medical needs, maybe things like amputations, severe mobility limitations, who need services but don't meet that acute or post-acute medical respite criteria, meaning that a stay of 7 days is not going to solve or improve that situation. It's more of a housing need. So that's something that we deal with and try to mitigate that by referring to different housing support programs, our friends at Independence Place, or our PACE program at Bluegrass Care Navigators that can work with those individuals as well. Individuals with complex behavioral health or substance use disorder needs. So we really try to take a proactive, non-judgmental approach to those for individuals with substance use disorder, making sure they're connected to treatment and that they stay in treatment, that they don't miss doses, that we provide transportation to get them there, get them connected with other recovery supports, those types of things to prevent any gaps in care. And then lastly, the other challenge is just individuals who need assistance finding housing, of course, maybe with financial limitations, if they have no income, and just help in navigating that in such a short time. We do help with completing applications, getting them needed documentation, those types of things as well. When we look at successes, really focused on health equity and again, access to health care. One example, an individual who had been in need of a feeding tube, basically had no connection from their mouth to their stomach and had multiple repeated emergency room and hospital stays over a 3-month period, but they were unable to do the surgery because he was living on the street and no safe setting to recover, no support system. So we worked closely with the hospital case management and medical team, with local shelter, with the post-discharge clinic, and a community health worker from the hospital as well to develop a plan. The patient obtained that needed surgery, came to medical respite for a week where they received daily visits, some intensive education on how to manage that feeding tube independently, and then transitioned them to the shelter that was able to provide services, and that community health worker continuing to follow that patient after discharge from medical respite. So that's just one example of the type of patients that are served. When we look at ongoing evaluation and improvement, always receptive to any feedback, both from patients, from partner facilities, healthcare providers, and encourage that. We do have frequent contact with our hospitals and shelters and healthcare entities, and address and collaborate on those patient needs in real time. We're part of the Bluegrass Community Care Continuum, so working with that coalition to address the needs of the most vulnerable in the community. We do have regular meetings with hospitals and Medicaid MCOs as well. Ongoing training, quality improvement activities. We continue to explore initiatives or funding to support medical respite. So for instance, with Team Kentucky's 1115 waiver has a new initiative for health-related social needs, which is a type of medical respite with some clinical support and housing support. So we're continuing to work with partners and providers on that in the state as well to learn more as that is implemented, to see if that's an opportunity to be able to expand our services and or provide some funding to support those services. Additionally, as part of that actually too, we've been meeting with the National Institute for Medical Respite Care, so we are always looking at their best practices and making sure that our processes align with those best practices. One thing that we've done this past year, we are in a pilot program with the University of Kentucky Hospital to support individuals who are needing outpatient IV antibiotic therapy, who are having to stay in the hospital solely because they are unhoused or don't have support systems. And that is, again, one of those emerging practices from the noted in the National Institute for Medical Respite Care. So we've been able to successfully transition several individuals in that pilot program who can receive needed treatment in a less restrictive environment, and then have some really great successes in connecting them on with some temporary and permanent housing solutions afterwards. So that's been really exciting, and looking at just how we can continue to grow and expand and provide the best evidence-based care to individuals who need it. That's all I have. Happy to answer any questions.
Thank you. We'll open up for questions and comments for this presentation.
I have a couple. So I know with this program, since it's really an as-needed shelter bed and not necessarily something that we have a firm target number, do you know offhand how these numbers for the annual period served would kind of compare to previous years? Are you seeing similar numbers?
Yeah, I think similar. I think when we see our number drop, we have longer lengths of stay. Oftentimes when we see longer lengths of stay, we see better transition to permanent housing. So it kind of, you have to find that sweet spot, I think, of, I don't know if it's a sweet spot, but making sure patients have the time to recover, and then begin, having that time to work on getting them transitioned so they're not returning to the street and then ended up back with us. I don't have offhand how many we served last year. I think it was a little bit more than that, but again, I think it often correlates with the length of stay.
And I know with our winter program where you're able to serve people throughout the season, not necessarily limited to an acute period or acute need, the outcomes are even better in terms of permanent housing exits. You also mentioned 13 individuals that were served more than once. Do you have any kind of sense of what that's related to? Is that multiple acute needs, or is that more indicative of a need that's not acute that maybe indicates a need for additional long-term respite resources?
Yeah, I think those are individuals who have multiple complex medical comorbidities. They have serious illness that are having multiple rehospitalizations. I want to say it's more of our chronically homeless population that are returning. In those, yeah.
Do you think this is like, I know this is kind of as needed, but is this a true indication of the need, or do you think it's higher than this? Because that it seems like there could be a lot more people, so I'm sure you all have to filter out based on availability.
We do. We really have to look at each individual case, and we try to explore, are they homeless? Are they a resident of Lexington. We get a lot of referrals. We get multiple referrals daily to this program. So we really do, based on funding and capacity, have to limit it to those with those short-term post-acute needs. Additionally, we don't want to accept someone from a hospital setting who they just had a bilateral amputation, they have no income, they have no potential discharge plan, at the end of a 14-day stay. We just say, well, okay, you're done, and that's not a safe plan either. So we're really working with hospitals and healthcare entities to try to make sure that there is a plan in place and a safe plan for those individuals. But yes, we get a lot of referrals, and certainly have to look at those each on a case-by-case basis. I'm hopeful with Medicaid's waiver. I would love to see that, flesh out. It does, one of the stipulations is that medical respite be provided in like a brick and mortar 24/7 staffed location. So that's something we continue to explore on what a partnership or what, opportunities may exist. Our model is a hotel model, which is used nationally. And we're one of only a few in the state of Kentucky that provide medical respite. So that's something, though, I think, especially, recognizing that housing is healthcare and to see some steps taken in that direction. We'll see how that fleshes out and if we have any opportunities to help support additional patients through that.
Would love to have additional conversations offline about how we might start building towards something longer term or something that might be eligible for Medicaid. I already have at least one person I'm talking to that I think I want to make sure that you guys are talking to as well, but then just kind of think ahead about future funding opportunities.
Go ahead.
I was just going to say, I don't know if I have a question as much of just a comment about your challenges, and just the first two challenges you've listed are definitely, I think, people we've probably referred from Eastern State who they don't have acute medical respite needs, but they have mobility issues or something that keeps them from a shelter. And then, of course, the second bullet point, the complex behavioral and substance use disorders, and that just remains like a real challenge for our community of those folks that don't meet your criteria, but then not a traditional shelter either. So,
and I think that second bullet with the complex behavioral health and substance use, we've really spent some time over the past few years. We participated in UK's Healing Communities study where we actually created a care navigation training manual with the University of Kentucky on specific to opioid use disorder. So we've really gained a lot of knowledge in treating individuals with substance use disorder, mental health care. So that piece I feel is less of a challenge than the first one of those mobility limitations that are not acute remains probably our biggest challenge.
Just to make sure everyone keeps it on their brain, we did have a shelter study recently go to the council that recommended a need for additional shelter beds, including for persons with disabilities, mobility limitations. Mayor Gordon has called for a task force, which we should get more information on very soon, to do some further work and exploration, try to get us to the goal of additional shelter. But I'm sure there's going to be a need for additional advocacy. We really appreciate partners who did come out at the presentation, make public comments, speak to the need, or even just show up in the audience. But we'll keep you informed of upcoming dates, because I'm sure that we're going to have other times that we're going to need that level of support.
Any other questions or comments for this presentation and program? Okay, thank you. Our next presentation is for Independence Place on intensive case management. This is from the Innovative and Sustainable Solutions Fund. Turn it over to you.
Okay, Eric's going to give a more thorough in-depth of the numbers. I'm going to give a little brief overview of Independence Place. We're a center for independent living. We help people with disabilities live in the community, any type of issues that are preventing them from living successfully in the community. We help people work on those issues and adapt and find accommodations for them. We provide 5 core services to do that. Everything we do basically revolves around 5 core services: advocacy, research, information and referral, helping them find resources in the community, which is a big part of this because we don't have funding that provides housing. We're just helping people find housing with the resources that they have and the resources that are available in the community. Independent living skills training. Transition services is helping people transition into employment or help them transition out of institutional settings into community-based living. And peer support is a huge part of what we do. 51% of our staff and board members have to be people with disabilities. So when people are working with our office, they're going to see people without disabilities and people with disabilities. And so it really gives people the confidence to know that they can lead a meaningful lifestyle and be able to be included in the community. As far as, I won't go over, he can go over the numbers, but the, this grant for the OHPI was geared towards serving people with the most significant disabilities, because people that are unhoused and have the most severe disabilities, we still help people with housing and stuff through our other programs, through like independent living skills. We can help people find housing, people who have disabilities, but specifically for the people that we served in this grant, it was for people with the most severe health conditions and usually multiple disabilities or medical conditions. We did do well reaching the numbers we expected. Again, I'll let him go over the specifics, but we expected to work with 66 people and permanently house 50% of that. And we ended up hitting the number, it was like 37 that we were able to permanently house. Some of the, we actually, there's more females that we served compared to the male population, which is interesting because across the state, there's more males with disabilities that are unhoused. So for some reason in Lexington, we had a larger number of female population. As far as for improvements of evaluation, you'll see in the numbers that the income, helping people increase their income, we were a little low on that. And we also had the health reports of increasing health improvement. We had lower numbers on that. I think that what we'll do going forward is specifically require that after 90 days of being housed, we're going to make sure that we get the surveys filled out by the consumers, because we missed some of that data. And the data that we did collect was great because it showed that 5 out of the 6 people that we had the data reports that there was health improvements. I mean, I just expected that to be a positive thing because when you put people in housing, it's going to improve their health situation. But anyways, like I said, I think hopefully we'll be able to capture that data a little better in the future. We've done great on the numbers as far as getting people housed. So that part of it is down. And I'll just let Eric go over the numbers if you could, please.
Yeah. So first, I would like to take a moment and thank Bluegrass Care Navigators and all the other agencies that have referred people to us, because our organization, since we focus primarily on people with disabilities of all kinds. And so by doing that, we got to help all these other agencies to kind of take their workload off and assist in helping some of the people that they had through the winter program and through their own programs to find them permanent housing. So it's been an incredibly wonderful partnership through you and through Passport specifically that I know we've really been able to help a lot. As far as some of the numbers go, of course, you can see on the piece of paper, we had a target of 66 and helped 56. And as far as the households go, we had 27 that we actually helped out of a target of 33. And like Brian mentioned, our largest numbers were with women, with females. But the other thing that I would like to focus on for a minute here is, if on here the age breakdown, the highest number of people that we helped were between 55 and 64. And that's because somebody who is in that age bracket who has a disability has, I think, an increased number of barriers in trying to find safe, affordable, permanent housing, because these also represent people who are on more or less a fixed income, to say the least. So that is something that I wanted to make sure that everybody's aware of, is that the demographics of the age group that is needing assistance has increased, at least in the past year since I've been there and before we started keeping these kinds of numbers. So let's see, as far as the average month, 6 months is actually, we're really proud of that because our turnover has been really good as far as from the time we first encounter the person. I will point out, in the amount of time that it takes, one of the biggest barriers that we constantly are encountering are people that aren't what we call rent ready. They don't have a driver's license, they don't have a social security card, they don't have a birth certificate, they don't have proof of income, award letters. These are all things that, a lot of them are coming to us. This has all been unaddressed. And it's one of the things that I'm hoping that as we go down the road, we can work more with our partners in finding these things out before a lot of them come to us, because we're like finding out, surprise, I don't have any of this stuff for you to help me find housing. And so we have to take that extra step to make them rent ready before we can actually even find them a place. So that's been one of our barriers that we've been running into. So other than that, like I say, it shows here that 37%, we're really proud of the fact that we have been able to work with a lot of the private apartment buildings and landlords and property management companies to find housing, and specifically finding housing that is what we call ADA compliant, or something that they're able to actually have access to. That's also been one of the ongoing barriers we find. Our majority of our clients would like to have first floor apartments. So that's the same, finding that access to first floor units in the city is always an ongoing challenge, because that boils down to the real estate adage of location, location, location. And then as far as the employment, and I can't really speak to much of this, is the employment and increased income, but I will say that a majority of the people that we also assist have either, for whatever reason, lost their disability and have to reestablish that disability, or have been denied disability through Social Security and have to reapply, or what's the other one I'm thinking of? Feed their case a second time, sometimes a third time, because Social Security, as we all know, likes to say no. First time, second time, third time's a charm sometimes. And then the improved health and well-being, that is such an individual thing that we, the clients that we get usually either have some type of medical assistance already, or we try to refer them to that type of medical coverage that they might need to get for their own specific use. So,
it doesn't represent the numbers, but I've seen anecdotally people that have been picked up by the paramedicine, they end up in the PACE program, and then through a program like ours where they're in a housed situation, it makes a world of difference for people that, health-wise, to be exposed to the elements outside, and then we're able to get them in the housing. It's like, it really, whether we captured that data or not, I think that I've seen it where it does definitely improve health.
Well, in this day and age where you have people that are going to urgent care versus hospitals, I still see a larger number of people going to hospitals, only because the administrative ability of a hospital to find them than temporary housing. I'll be real honest with you, a lot of them will say, well, I'm just going to the hospital so that I can get referred back out into a respite care. So they kind of, try to use the system to get off the street and to hopefully maybe parlay that into finding housing. Very resourceful. I have never seen a group of people that are so incredibly resourceful as we did through the winter program of, knowing what they need to get and doing whatever they need to do to get it. And I love the fact that a lot of our people that we've helped through this program are very self-advocating, because it really does make a world of difference in finding them permanent housing when they're willing to say, tell me what I need to do and I'll do it.
And I'd like to add about the lower numbers for the increased income, maybe not helping people find employment or, getting signed up for benefits. But one of the issues we ran into was the changes that have happened at the vocational rehabilitation. We have our IPS supported employment program that helps serve people that are with mental health issues and substance use disorder. And voc rehab has made it very difficult for us to get referrals to that because we're trying to, while we're working with the people that are working with our housing advocates to find housing, we make a referral and they've made it more stringent, the requirements for the medical documentation. In order to get the referral to the vocational rehabilitation office, they required a much longer referral process. So our IPS team made like this 12-page referral form, and it's like now it's just like, it's really difficult to refer people to that program. It used to be easier where we could just say, I have this person, here's a simple piece of medical documentation. The rest of the medical documentation can get gathered later, but like I said, that's not happening now. So I think that made it more difficult for us to refer people to that. We did refer people to regular vocational rehabilitation, but it's just unfortunate that we have this in-house program. And I think that, as I said, that's going to be something that will be improved by this new process that we have. It's quite cumbersome for them to have all these details that we have to include when we're making the referrals to the voc rehab. Because I think those are the kind of things that should be, once the individual meets with the voc rehab counselor, those are the kind of information gathering things that should be happening when they build that relationship.
And one of the things we do actually plan to do with the second time around with this is we plan on, well, we've already applied for Medicaid, so we're waiting to see if we can get approved for Medicaid Part B and C. Because with that kind of added budget, we would be able to assist more in some of these areas where we're finding a difficulty with like OBR and other areas that we can then be able to better address. So
we'll be able to provide case management services through the Medicaid waiver system. So
we kind of do now, but it's not the same as if we have Medicaid. So we try, but it ends up being more of a referral system than an actual case management in a lot of cases. So with that, if you guys have any questions, is there anything I didn't cover or Ryan didn't cover? Feel free. Questions or comments?
I was just going to inquire, I know that we touched on increasing income and folks that have maybe lost benefits or need to get benefits established. Do you all have SOAR trained staff?
That's a really good question. I know that one of our staff members had started the SOAR training, whether or not that's been completed or not, but that is something I think we need to probably address going down the road. It's just a matter of right now. It had been better for us to directly, take clients to Social Security office and have them work with that directly. But now with everything that's going on, it's probably going to be a better road to go down in the future.
It can be a very time-consuming process to work on an individual case, but in terms of the process, it does expedite that a lot in terms of getting considered and potentially connected faster due to the housing status.
And I think, like we said, if we do establish this, it's going to be first in Louisville and Bowling Green, in those offices where they're going to establish the case management and Medicaid services. If we can do that, that's going to generate funding for us so that we can use that to have more staff that are available to do SOAR training and stuff like that. But I mean, as he said, we tried. One of our staff was training on it, but it's just there's so many other things to juggle with such a small staff that
it's almost
like
over
capacity in our field of work. No.
It's one of those things where we would probably want to take somebody who does our IL and have them specifically work on SOAR as well. So, but yeah.
And I think that referring people to Social Security attorneys is the next best step. Like if they're not getting any benefits right now, I always think that they're only going to take, 20% of the backdated funds that they would receive. So I mean, a lot of times that's something I would be willing to do as opposed to until we're able to learn that process ourselves. Because the last thing I want to do is make someone wait a long time and not really be fully informed about how to get them the benefits that they are eligible for and entitled to.
But I'd say the vast majority of the people we work with have had disability before, but it's lapsed, or they've just lost their card, or had it stolen, or don't have their rewards letter. So it's just those little things that you have to have for a landlord to process an application. Without those core things, then finding them housing is extremely difficult. So we try to quickly get them whatever they need, or tell them how they can go to get it. The free driver's license or free ID through the state has been a godsend, because that has streamlined getting at least that aspect of it. Because some landlords and property management companies will accept the black and white paper printout until they get the permanent. Social Security is a whole nother creature. So.
And this might be a question for you, Jeff, but I know in the past we had allocated some funding to like the driver's license program. Are there services that help get other types of documentation that might be something that we could help?
So we did provide funding to support access to the 1-year state ID for those who are experiencing homelessness, and then the state made that free of charge last year, as well as obtaining a Kentucky birth certificate. We maintain a guidance document on our Google Drive, and we have a bit.ly or a short URL. You can access that at bit.ly/K, homeless, I, and that will have all the required forms, as well as a guidance document that's going to include things like points of contact with the state if you want to generate an account with them. You can put a credit card on file if you want to access higher levels of credential, like a driver's license or a real ID. Those are not free, but there would be, of course, free state ID. In terms of other services for critical documents, that would be one of the things that we're including that individuals can potentially gain access to through our Housing Flex Fund, which we're hoping is going to be accepting referrals around July 1st. The agencies operating that fund are Community Action Council and Arbor Youth Services. And because we only have 2 operators, we're starting first with a kind of closed partner referral network. That's going to be our outreach teams and centers, our emergency shelters, and our housing providers. And households would have either a $2,000 maximum for single adult households or a $3,000 maximum for families with children. Obviously, critical documents wouldn't take a lot of that, so they could also potentially get some other assistance in other areas. But that would be one resource that we would have towards
So like that, the Flex Fund.
Yeah, so like if they, for example, out of state might be something that we have to pay maybe $50 for a birth certificate because there's a cost and then additional processing and shipping fees, that's totally something that could be covered by the Flex Fund.
Well, and I'd also like to bring up, because I just learned about this literally, the other day, so new to me, that I think it's a New Vista drop-in center. If you go in there, they will make a copy of your driver's license, your social security number, and your pertinent information and keep it on file. Because one of the things that we encounter a lot is if they are virtually homeless on the streets, they have their stuff stolen, they may have all that information, and then next thing you know, it's gone. And if there was a way of having some safe, secure way of copies of that, so that if they need to re-access that, would be huge. I mean, we try to do it, but because of securities, we try to keep to a minimum the kind of personal information we have with our clients.
So one thing that we always kind of encourage people to think about would be potentially scanning those documents and uploading them to HMIS onto someone's client profile. That way, copies can be accessed, or even if it's something where maybe a landlord's willing to run a check with just the ID number, that might be something that's available.
Yeah, I was gonna say, we can do that at New Life too, just we upload them to HMIS.
And nowadays it's pretty easy with a camera phone to just be able to snap that and upload it.
I had a question, and I apologize if you did mention this already. How are you measuring improvements in health and well-being? Do you have like an internal thing you've created, or have you found like an outside measurement tool? I'd be interested in that.
We do some wraparound service, so we have an independent living specialist. But we do reach back out, because we keep a file open for at least 90 days, and we check back in on making sure that they're housed and remaining housed, and checking how their health and well-being is. I mean, we don't keep a number on that, but we do follow up with all of our clients to make sure that they're improved, their life has been improved. I mean, a lot of times they'll let us know if they've gotten into a housing situation that they don't feel is healthy for them for whatever reason. But yeah, we do personally reach out to all our clients. So yeah, once we get them housed, we don't just close the door and walk away.
Okay, so it's like an interview based instead of.
Yeah, we created a survey that they fill out, but it's qualitative data, so it's doesn't.
Okay, nice.
But we do, we tried to do a follow-up and make sure for at least the first 3 to 6 months, they get housed, that they're okay, they're all good,
Thank you.
Any other questions or comments for this presentation?
What is the, do you all know the breakdown of disabilities? Like I'm specifically interested in like mental health, like what is, like how many of the folks you serve are primary mental health disability?
That's actually a really good question, and I don't have those specific numbers, but I can tell you from my experience that the highest number of people that we're helping are with SUDs.
SUD?
Yeah.
We could find it, we could get that, we have, our concern, it's not too many people, we could probably break that out in some way and probably be a good.
I just actually mentioned you all today because one of the social workers on Empath said somebody came in and the only thing they wanted was a job. And I was like, well, there's this place, Independence Place, that you might want to refer them to. So yeah, I think from Empath, for sure, we could probably, and I was going to ask just as far as referrals, like from, if you take referrals from, Empath's not a hospital, but what would be the best way? Of course, we can give your information and give that to people, but is there a good way if we do have somebody who's just really interested in, specific help with finding a job and they've got obviously a mental health disability, or do you guys really have any criteria? Like, do people have to show or prove their disability, or do you just take it as they're saying I've got a disability and you accept that?
Usually 99% of the time, if they're getting disability through Social Security, that's proof of disability. The other things that we can do is ask for medical verification of a disability. We have a form for that as well. But I can give you my email address, but our referrals, we've now kind of streamlined our referrals. So instead of going to me or him or everyone else in the office, our office manager, Shalise, takes all the referrals and reviews them and then basically gets it.
Yeah, maybe we could connect a little bit after this, just because I do feel like we see a lot of people from Empath and they're not meeting that acute level of going inpatient, and so their reason for presenting to Empath versus more Eastern State, it is things more like job, really wanting to find a job or needing help with those resources.
Yeah, and I'm sure I'm preaching to the choir here, but as you know, OVR, who our employment specialist works with, has a wait list. And it is not nice.
Yeah.
I just ran a quick HMIS report on their project, and about 28% of individuals self-reported a mental health condition.
Oh, okay. Interesting.
Do you refer any of the people directly to voc rehab?
Gosh, not from Empath because we just have 23 hours or less. We definitely have from the Eastern State side, but I don't know how many successfully, because I guess like you said, I think when we've called and inquired, there's a wait list or it's just not accessible.
Yeah, it's a order of selection that they've implemented now, so they're taking only people with the most significant conditions and circumstances. But still, they will help them. They'll get through the list at some point. But,
yeah.
And if they have more than several things like against them, like lack of family support, those things can all count and get them to the head of the list. So.
We're also going to be having some discussion at next week's advocacy committee meeting around employment and earned income and trying to increase that and developing a formal COC strategy. I've invited a couple of our employment support organizations and want to engage them and our housing and service providers in some brainstorming. We're also going to have New Vista share some information about their IPS services, so that if other organizations want to pursue that, or if we want to pursue that as a system, that's something we could look at potential funding for. So definitely relevant to this conversation. Might be something to join us next week and talk about.
Sure, definitely. We'll be there.
I just want to say I do appreciate the partnership. We had a higher discharge rate to permanent or temporary housing, both in our winter program and in these, and that's largely because a lot of those patients were connected to Independence Place and their services, and they worked very quickly to help expedite that when possible, so we appreciate that.
We're small with a big heart.
It's a huge help.
Any
Thank
other
you for your
questions
work
or
and your
comments?
presentation.
Our next presentation is for LFUCG for the COC planning grant.
So as I said, my name is Marissa. I'm the Continuum Care Coordinator. This grant oversees several job duties, including the COC's collaborative application as a part of the Continuum Care grant process, monitoring established projects and system performance targets, use of HMIS, making sure that we're connecting with end users, that we are helping to facilitate any HUD standard changes to our end users, directing the policies of coordinated entry, helping and planning with the annual point in time count, of course, helping and assisting with any board and committee duties as well for the continuum, and continued improvement for our entire system. Making sure that we're following federal guidance for preventing and ending homelessness. So a couple of things that this grant has done in the past year. We have continued to serve as the HMIS lead. This grant covers my entire position and then part of Adam's position as well. One of the things that we've really tried to emphasize is make sure that we have increased HMIS participation with confidence in HMIS. So not just making sure that we have a lot of end users, but making sure that our end users know what the data means, how they should be able to read reports, how to use those reports to improve their operation, and making sure that we also have that continual, right, we never have a lapse in data quality as a part of those efforts. We are a part of the KY HMIS, so we work really closely with our partners in the balance of state as well as Louisville in pretty much all things HMIS, and we do a lot of technical assistance. In addition to just training end users, we have our HMIS end user work group as well that happens, and then we also strive to provide any additional tools and resources, especially if any agencies or organizations or even individuals reach out. Other parts of this grant, which covers, is focusing on continuous lived engagement and improvement. That's something that we really strived to accomplish last year when this grant term was, making sure that we were not just soliciting feedback from individuals with lived experience, but then demonstrating the implementation of that feedback. Wanting to make sure part of this grant can pay for those efforts, so we want to make sure that we are doing our due diligence and incorporating those who have that experience and that expertise. Other elements that we have strived to improve upon through this grant is our coordinated entry process. Last year, as many of the folks in this room know, we've successfully created a local assessment tool, moving away from the VSFDAT, and that was a lot of work from a lot of people in this room, and helping using that as our guidepost. We also made a lot of changes to our policies and procedures regarding coordinated entry. I included some measures which look a little different than a lot of the other measures that people have talked about so far, but just in terms of kind of how do we put numbers to the work that we're doing, our number of HMIS new users, our total number of HMIS users, training. We also have technical assistance for agencies or end user work groups, VASH imports, our data quality technical assistants, our number of Lexcount volunteers, and then two kind of new elements that we've added this year. One is the number of coordinated entry reports. Last year we were really consistent in ensuring that we had those coordinated entry reports that were presented in our data and systems integration committee meetings. And then something else that we wanted to do to make sure that we were trying to continuously push our continuum of care, that COC local competition, forward to ensure transparency, to ensure collaboration, and to make sure that our grantees also felt fully supported, was have a 6-month review for our agencies. So trying to check in about halfway through their grant term, what is the data saying, where are we in terms of spending, and how can we as an office help support you to make sure that that grant is successful, that program is successful, and also so that we can hopefully, right, continuously improve our system performance measures, because part of this role is conducting, I guess I could have made that a measure as well, but successful HUD data submissions, and that's part of what this role entails as well. Thankfully, they were all very successful last year, even though I did not include it here. But that's something that, right, we want to continuously try to ensure that our system performance measures are always growing, and if they are not increasing, then why is that? Let's dive into that and try to create some formal strategies. Which brings us to our evaluation and improvement. Some of the things that we would like to see this grant kind of really spearhead is conducting data deep dives. So, right, how is this data, right, this is not just numbers, but how are we actually utilizing this data to explore maybe something that we're seeing anecdotally, but do the numbers actually pan that out? And also providing our partners with the tools to do the same, right? Like, data is not just, you know, how are we, like, how many people are we serving, actually diving into it to tell a compelling narrative. Which brings us into something else that Jeff had mentioned, right, at our next advocacy meeting next week, having formal strategies, so doing some strategy spotlighting to make sure that we have some explicit formal strategies that as a continuum we are able to follow and push forward, and so that way these system performance measures, we're not just nebulously trying to make them better. We actually have a strategic plan that we're following and trying to push forward. Other things that we are trying to improve through this grant is, of course, greater participation in our end user work groups, continued HMIS training with increased confidence, especially after the first training. We know that that can sometimes be a big hurdle or big ask, but we want to make sure that our users are feeling really confident. Ongoing HMIS data quality technical assistance that centers the data quality. This is really helpful for our HUD data submissions, as I previously mentioned. And then in regards to the COC competition, we want to ensure greater transparency around that scoring and ranking of projects. We did a lot of that with our lived expertise and lived experience group this go round. We also had a webinar prior to that local competition starting about what this grant means, how to apply, how to, what type of efforts can be done preemptively before the local competition opens. And then even still, some of those new organizations that were striving to apply, we would then had some one-on-one meetings with them afterwards. How can we help support you through this local competition? So we want to make sure that we have that increased support and also an increased number of new project applications. And then lastly, we want to continue to have the collaboration and partnership with everybody here in this room and beyond, just to ensure that we have, successful, a successful system for things like Lex Count, for things like thinking about ways that we're hopefully creating new and innovative ideas that can sustain this work. I don't know if Adam or Jeff has anything else to add.
I think you do a pretty good job of covering things. I would just like to thank both Adam and Marissa for their work. I know we are a relatively small team, but we're growing. We are now 3 and next fiscal year 4. So that's really positive. And I think some of the things that we've been able to implement have been really helpful. Marissa mentioned kind of a halfway mark or 6-month review for our COC program recipients. We've really found that has really been something that's really helped a lot of our providers better understand how they're evaluated, how that ties to their data. I just think there's a lot of good conversations and a lot of education that is happening through that process. We're definitely open to questions.
What do you consider technical assistance for agencies? Because I would imagine the number of emails you receive from all of us with questions would far exceed that number.
Yeah, so I consider technical assistance, and I asked Adam for his number too, so he may have a different definition. I just said, how many technical assistants, inquiries did you have? And that's how we kind of came across it. I have viewed it previously and for this report as something that was a little bit beyond an email. So we had to hop on a Zoom, I had to record my screen, I had to get on a phone call and say, okay, here's how we're doing this. So something that's not just a go here and go here and go here via email is what I've indicated as technical assistance.
What's reported here is going to really reflect more individualized assistance with a user or an organization beyond basic data quality. Yeah. So you'd be correct, there's a lot of other things that aren't going to be captured here that are just helping to correct an error or an issue someone's having submitted to a report, things like that.
I mean, I think include it all to show the work that you're doing.
It's like 28 a day.
I was like, that's probably me in a year.
I'm not going to speak for them, but I think part of it's just finding the system to keep up with tracking that is challenging because it's just constant.
Most of the time, the easiest way to track this number is to go back and look at my calendar and see how many Zoom calls did I do. Yeah.
Well, thank you all very much for all the help you're providing.
Of course. Other questions or comments?
I guess just a comment, we've been doing our 6-month review, and it is the most painful thing ever. Don't do it. No, actually, it's been extremely helpful, so I think it's a wonderful thing that you all have created to kind of do it. We're new in this great year recipient, but it just can get, data can get confusing, and what people are looking for, and being able to evaluate what, not that all data is not important, but some data is more important than others, and what are we really trying to get at with it. So I really appreciated you all spending time with our team, so yeah, it's wonderful. Thank you.
Of course. The goal is to help support your team, and I know I say this a lot, both in HMIS as well as the COC competition, but the data, you all work incredibly hard, and we want the data to reflect that hard work, which is part of the reason why we want to continually support you all. So that way, right, it's not just a number on a page that we're trying to look at and evaluate. I mean, these are real clients that we're trying to help assist, and you all do very real work that is very difficult, and we want to make sure that we're striving our best to help support you all in doing that work.
And I think it's something we're all trying, I should speak for everybody, but we're trying to do better, because you get those quarterly times or month times that all the reports are due, and quite honestly, you're just so happy to have everything filled out with a number in it, that you never really have the good time just to kind of go, well, why did I have 3 people here? You just don't have time to go back to evaluate it, because here you come again, and so I like that you all sort of slow it down for us a bit to look at it at a time that it's not report time, it's pre-report time. So thank you. Yeah, it's good.
I have one question about the numbers for 23 to 24 for the new HMIS users. Mm-hmm. I know that this kind of push to really get people trained has been going for a while. So do you think that decrease from year to year there from the 35 to the 23 is consistency of staff, so we don't you don't have new people to train, or what do you think is happening there?
Yeah, so I can speak a little bit about that. So about 10 of these folks were actually folks with one organization. They had like 2 staff members that had like their HMIS license lapsed, and then the others, they were like, we just have like a bunch of new individuals. Do we have the spare licenses? And at the time we did. So I said, sure, we can go ahead and do an agency specific training for you and your organization. And then by the end of the year, I think like all 8 of them, like, were no longer with that organization. So I ended up, right, that's like 8 individuals that now we've added license for, that we've since removed, and they've scaled back quite a bit on who. Now it doesn't need to be every single individual at the agency needs an HMIS license. It really should just be just those 2 individuals that they had previously indicated. And a lot of it is talking to our organizations about their client needs, right? Like part of it could be that we have like some organizations that have scaled back, right? Like we thought that we really needed HMIS, turns out we actually don't, only a few members of our team do. And then also part of it could just be the like sustainability of and the staff retention of that organization, because if they don't have retention, or if they do have retention, right, then there's no need to train a new person.
I would say definitely one thing as we've been a lot, as Marissa said, a lot more conscious about when organizations want to come in, starting small, get a couple of key staff and key roles trained. If the utility is there, if it's working for your agency, then we'll scale up. I know I had been involved in the past in Marissa's role with some agencies that right off the bat wanted to have, you know, the 10, 12, 15 licenses, and it just usually didn't pan out to anything meaningful within our system. I think we've also been focused on making sure that as people come through new years of training, they're actually prepared to use the system. We had some challenges with continuing virtual training, which I know a lot of people really liked during the pandemic and as we came out, but things like people not being engaged, they're turning off their camera, they're doing other work, and then when they go to do their homework, they don't know how. And you even have people like falling asleep during training, and so we are being very clear, like if you can just attend the next one, and we will make sure that people are truly prepared. And Adam's also started doing some in-person sessions again, because we do find that even though sometimes that's not the most convenient for our schedules, it tends to produce people paying much closer attention, absorbing more.
And our total number of HMIS end users has remained pretty consistent, pretty steady from the past 3 years that I've been in this position, despite the number of, I think like even if we had gone back to 2022, we probably would see like another fluctuation. But the number of just users within the system has remained pretty consistent.
Thank you. Any other questions or comments?
Who's your 4th person?
So we don't have we're not advertising yet. That will be around July 1st, but we were approved for an encampment coordinator position. One of the things that we really wanted is something that would help improve our encampment outcomes. We're seeing a higher number of unsheltered persons. We're seeing more costly camp cleanups. We're seeing a lot of repeat persons who we're encountering at multiple camps. Sometimes that is distrust of the government. It's someone that sees outreach coming and automatically says, okay, you know, this camp's going to be marked for removal, I'm just going to go ahead and move on now. So by doing this position, one thing is it separates out some of our formal processes like posting notice on our encampment coordinator, and outreach doesn't have a role with that. They can just be service staff, so we can maybe get some better engagement, but also just having somebody that can take some of my work and do a lot of the administrative follow-up. People that do outreach are usually better at working with people. They're not going to be great at necessarily being able to track detailed spreadsheets and give me numbers that are needed for reports. And so instead of trying to make them be administrators, we're going to bring that in-house, have somebody that's going to be in the field more often, be able to identify service solutions and facilitate them, follow up on them, just be able to give a higher level of service, and then also work with our internal divisions, ensure we're following our policies for how we remove encampments, and that can coordinate all the work. Right now, that largely falls to me, and then when I'm not around, Marissa. And it's just, we're now getting sometimes in a given week, maybe 10 or more reported camps or issues, and that's just a lot for us on our capacity to be able to manage. So, we have an entity like code enforcement that might help us determine property ownership or work with the private owner. We have environmental services who actually contracts and bids out the work. Might be other entities like police that are involved, and so just a lot of coordination goes into that.
Sounds like a full job.
Yeah, so we're hopeful that there's going to be some qualified candidates that will apply. I can say the administration was really great in supporting that position. They made sure that it has already initiated the council approval process. So the 26th will be second reading on that position, and then we can move to advertise. A lot of the other positions that are being created this fiscal year probably won't see advertisement until about 3 months into the fiscal year. So we are going to be ready to go July 1.
Which I would like to make a real quick comment. It's actually an expression of appreciation and acknowledgement to Marissa, Adam, and Jeff. Your entire office, besides everything else you just named that you did, you held our hands through getting through the onboarding process of what we need to do to be able to report, to do this, to basically do everything, because we were pretty much street trained in helping people find housing and employment, that kind of thing, and you've given us a whole new tool and a whole new ability to help the community in doing what we do. So, and
thank you.
I want to make sure
What I would say is
everybody knows that.
We definitely see that as our role. We want to help our providers, and we want them to grow within this field and grow in general. So we are always here to support, whether it's HMIS, whether it's how to navigate being a recipient of funding. We are always here to support. That's what we want to do. Because if we help you be better, then our entire system is better.
But if I just could be so bold, I think they all deserve a round of applause from all of us who actually go to the city for so much. Thank you guys, appreciate you.
Yes, thanks. Our last presentation for today is the Lexington Housing Authority for the Landlord Partnership Project. So I don't know who's presenting from your group. Tracy? Okay. So I'll turn it over to you.
Okay. Good afternoon. My name is Tracy Holmes. I am actually a special purpose voucher coordinator with the Housing Authority. I've been there 11 years, and I do a lot of emailing, and it's good to put some of the faces with emails. So just a brief overview for individuals and families participating in LHA's assisted housing programs. The ability to secure housing that meets their needs depends on the willingness of the landlords in the private market to accept participants. And we do know that landlords may be hesitant to lease to LHA's recipients because of the program's administrative burdens or misperceptions about the tenants. We do have some excellent tenants. Some of them have gone on to own their homes through our home ownership program. We have some that have, but for the most part, we have some great tenants. As a result, participants may have few available housing options and be more concentrated in disadvantaged neighborhoods. LHA proposes to expand affordable housing options for recipients by using incentives, streamlined administrative processes, and customer service support, a staff liaison, to encourage landlords to participate in the LHA's assisted housing programs. We do also hold landlord meetings, I think quarterly. We get together with them. We actually all the caseworkers that are available, we usually meet with them. We have lunch, give them an opportunity to ask questions. We have questions or anything that we can do to improve the program. The Lexington Housing Authority is a moving to work agency that offers long-term rental housing and rental assistance for more than 4,600 low-income families, seniors, and disabled individuals and households. As a moving to work agency, LHA has the ability to develop local strategies focused on self-sufficiency and expanding housing choices for extremely low, very low income, and low income families and individuals. The MTW designation grants LHA the flexibility to observe what is going on in our community and target policies and programs accordingly. LHA's rental assistance programs help individuals and families access safe, affordable housing. From that standpoint, landlords provide an essential community service. Beyond generating income, their rental properties help individuals and families achieve a measure of security to achieve their goals. With a recipient's prosperity also comes enhanced community stability. The goal of the program, the Landlord Partnership Project, our funding amount is $300,000, and the goal of the program is to remove barriers for homeless applicants and to reduce financial risk for landlords, encourage landlords to open more rental units to participants, recruit new landlords and retain current landlords, and to reduce the time of lease-up for applicants. The LHA was to hire a landlord liaison, which I am glad to announce we do have our new hire here, Mr. Derek Feldman. So glad to have you aboard. You've lightened my load personally, but it is wonderful to have you. But to partner with landlords to navigate the leasing process. Landlord partners will receive personal customer service from the landlord liaison to assist and share vacancy leads, answer questions, and address concerns of landlords, assisted landlords to connect with the tenants, caseworkers, or supportive service providers to address supportive services that are needed. Also to hold tenants accountable by educating participants on what is expected of them as tenants. We also encourage tenants to hold up their end of the contract and to do what is required. Just for an example, paying the rent on time, keeping the property clean and safe, and communicating with their respective landlords. The grant was funded effective 7/1 of 2024, and LHA paid the first lease-up assistance on January the 23rd of 2024. Not only were we able to remove barriers for our homeless families, but we were able to reduce their lease time from 118 days to less than 60 days. From July 23rd of 2024 to May the 31st of 2025, we paid out $102,448 in lease-up assistance for security deposits and landlord incentives. Security deposits paid out were capped at the lower of the amount charged or not to exceed 1 month of the contract rent. Landlord incentives, one-time incentive payments of $500 to new landlords upon the execution of a new contract with a core participant. A one-time incentive payment of $500 to a landlord adding a new unit to the program or existing landlords. They also offer a limited damage claim, which is not to exceed $1,000 in cases where a tenant causes damages to the unit that exceed the security deposit. As it pertains to our numbers, our target number of households served was 100. We actually secured 58 new landlords. Target was 50, and to date we actually have 7 new landlords added. New units added to the program, the target was 50. To date we have 27. The homeless households moving, target 100, we have 58. The one-time incentive for new landlords, again, that was increased to 7 to date. One-time incentive for new units, to date is 27. Security deposits assisted, I missed one. Limited damage claims processed, 0. Security deposits assisted, 100 was a target. We actually assisted 60. Quarterly landlord group trainings conducted, the target was 4, they conducted 3. And training briefings for new landlords conducted, 52 was a target, and there were 17. I think that's all that I have. Any questions or?
Tracy, I'm just curious. I mean, I think the call over a lot of our housing programs is even when we get the voucher, we can't find people to accept the voucher. We have a really difficult time finding property managers and things. So I'm just curious from your all's work with it, what do you think are some of the biggest obstacles and what are your thoughts? Because that's been an issue, I think, with your program too. So what do you think we should be
And you
doing to
said-
engage property managers to accept housing assistance?
I don't know, and I think the landlord meetings that we've been conducting have been very successful. Not even having that personal relationship, with the caseworkers and then we're able to work together
Yeah.
with that tenant. And then communications.
Yeah.
Big. Also for myself personally, I think when it comes to referrals, landlords doing their own checks on the tenants. A lot of times, not a lot of times, some of them expect the housing authority to actually do the background checks. We don't do, suitability, we do the eligibility.
We do eligibility, not suitability. I think, though, that one of the biggest issues is the amount for us, as far as the voucher versus the amount of rent. Because the rents in Lexington are really high right now. So 1-bedroom voucher is $992, and that includes the average utilities. So you're looking at a unit to be around $700 and some dollars, and a lot of landlords want $900 just for the rent. So.
Right. I know we've gotten crazy creative with like deposits and things. Like, it's like, well, if I can give you this big deposit, and then, but it's I don't know.
We had got a grant from Kentucky Housing Corporation a couple of years ago, so we was paying out like $1,000 just for you to rent to a Section 8 participant. That does increase landlord participation when you throw money at it, but it's only gonna go so far.
Right.
So.
And I think there's still probably a cap on the number of landlords who are gonna take you up on that. And eventually they're gonna run out of units that they're gonna rent to us. So the market's so tight.
Yes, it is. Yes, it is.
Yeah, it's more, I think, like maximizing the landlords getting all their units, as opposed to just like finding new ones.
Are you all thinking as you go into the next year, you'll be equally as aggressive with the targets now that you have a new person to sort of work with those landlords, or are you thinking you'll roll back the targets?
I think we'll probably keep the targets where they are and just be more aggressive. Hopefully next year it'll look a little bit better as far as the market. I'm not sure what it's going to look like, but I think we might, keep the targets where they are.
I was also going to ask about the targets, given that I know we fell under most of the targets, but I think I may have heard part of the answer in the presentation. It sounds like there wasn't an assistance payment until January.
I think she said January 2024, but it had to be January of 2025.
Yeah, so I'm thinking maybe some of that was also startup and implementation of a new program.
Right, because I think we didn't hire the first landlord liaison until September, and then really just get them off the ground and everything. We probably didn't pay out the first payment until January. So, and the grant's not over with yet either. So I think we're in our 11th month, if I'm not mistaken. So.
One thing I would also just ask about is if there's any specific challenges that you think require any kind of modification to the budget or the program design, because obviously we did write that initial agreement with an option for renewal, but we would have to take that back through council, so we would have an opportunity to potentially make changes. I'm just wondering if there's anything that you've identified that would be a need or be helpful.
I can't think of anything, but I'm sure my supervisor can.
I was gonna ask if it's okay. I think if we,
it will be definitely something I'll take back to Aldine and, to see if we want to make any modifications too.
I was wondering, when would you need that information? If there was an interest in some sort of change, when would?
So right now, we probably are gonna have to look at doing an amendment to your agreement to extend the period of performance on the current term. We can backdate that as we take it through council, which we'll probably need to do because they're getting ready for summer recess and we won't be able to get something through in time. But I would like to look at the remaining funds and maybe moving the period of performance and extending it out. Go ahead and continue to spend down on these funds and then engage the program performance and evaluation committee about looking at additional terms. I think we'd probably be best served to go ahead and keep spending on the money that you have now. So let's just make sure that we connect sometime in the near future, the next maybe 2-3 weeks, have that conversation, figure out any kind of changes that we want. We'd be looking to try to get something into our Legistar system to go to council sometime in July.
Okay, I'll get with Aldine when I get back to the office.
This is an odd thing, so it might just be goofy, but I would imagine a lot of property managers that are willing to often accept vouchers and work with us often have properties that need some work, you know? And I didn't know, like, I've heard us talk about it before, but I'm curious if there's any monies that rather than like all these extra deposits and things that we get creative with, that there could be assistance in helping them get their place, their facility up to code, their
And it's a
apartments
nicer
up to
place for
code.
them to live in.
Yeah. What's your thought on that?
I think that
We have money for that.
that could be something that would take some navigating. I think anytime that we as the local government fund anything that's seen as bettering someone's personal property, it can be tricky, and I think we had some success in being able to do that through some of our programs that help individual homeowners improve their properties, or someone improve properties where there's a commitment to affordable housing rentals. I'm not saying it's impossible, but there would have to be some clear parameters around it where it was a give and take.
Sure.
Where it would also somehow directly impact our success in being able to house.
Right, it'd be like if you'd be willing to take vouchers and work with our clients, there might be some assistance in
Yeah,
getting
there definitely
your
have to
place
be
up to code.
some parameters that would make sure that it did get back to our population. One thing that I'll just throw out there that we could think of as a potential change would be if there's any situations where maybe a participant, and this kind of is timely thinking of someone that we've discussed recently, if there's a situation where a landlord might be on the hook for some money because a participant had a change in income, wasn't able to pay their portion of rent, maybe looking at if we want to install a small amount of dollars to do some kind of prevention assistance. That could be another thing that I think might be appealing to a landlord because they know that we might be able to step in and fill that gap.
Sounds good.
Well, I'd also like to make a comment, because like Diane, I have been way out of the box in trying, because believe it or not, in the work I do a lot of outreach with individual landlords, and I actually became an informal part of a bluegrass realtor investors group on social media. And I have actually talked to 5 different personal property owners who have property they manage their own. Out of those 5, I think I had 1 that successfully signed up with you guys, and that was mainly for the voucher program. And then another landlord who he found the site too cumbersome, too confusing, there was just a million different reasons why they were like, I just didn't want to follow through with it. And it's almost like if there was a breakout site just for property owners, just for landlords, so they're not dealing with the main LHA website, because it can be
right, but so our website really doesn't have.
Has a phone number, I think.
Yeah, it doesn't really have a site just specifically for landlords.
Right. But I'm just saying that they come up with reasons. And my thing is that I'm more than happy to do outreach for you guys, because I believe in what you're doing, and I believe there are landlords out there who'd like to be involved if the process was simplified for them.
Well, maybe we just need to put his information on the website to contact him when they're interested in renting a unit.
Yeah, and I think that actually is a brilliant idea, but I also, in working with some of the other groups that we do here, because I had another landlord who I got a tenant into, and he had a voucher through a different organization that was just for deposit and rent. But yet the landlord still didn't quite want to commit to taking vouchers, but I think he would if we were able to approach it from a different angle. And I think there are a lot of landlords out there that, again, their properties may need a little work. But I think that just in doing the outreach, I hear a million different excuses why landlords don't want to do it, and I think it's just because they don't understand the process. It's too complicated for them. They want simple.
Yeah, and I think that's why we try to do the quarterly meetings, just to get everybody so they understand what it is, because I think it's a lot of misinformation out there about how vouchers really work.
Oh, for sure, yeah.
So we try to get that
It's
out
almost
there.
like sometimes it's probably easier to go to the landlord instead of trying to get them to come to you. Kind of.
Yeah, so that's, part of it, going to different complexes, going to talk to the landlords at the complexes and giving them a overview of the program and see if they want to, partake.
The landlord
in it.
I'm thinking of, he actually owns 2 different buildings on Arlington Drive that, I've tried a couple of times to talk him into doing what he needs to do, because he was really happy with one of my tenants. He is thrilled with our organization, sending in people that are pre-qualified and kind of thing. So it's just a matter of their having somebody kind of baby him through it. I don't know, landlords are weird.
I talk to them all the time.
And property and property management is even weirder, because I keep hearing, well, I manage other people's property, so I have to go to the property owner and clear this through them and then get back to you, and it's just a whole nother property management companies are the absolute bane of my existence as far as, they have affordable properties. But the other thing we run into is this, I need 2 or 3 months income, proof of income, to qualify as somebody who's on a fixed income or is in low income. And, sometimes the only reason they'll change their mind is the voucher program, but
that's where I think potentially something like some prevention funds. We know that this program's probably not going to be able to address the overall income requirement for the term of the lease, but if a landlord knew they could recoup 1 month's rent, and then for them, that might make it easier to voluntarily let somebody out of a lease if it's needed, or recoup some of their losses. And I think with connecting with the landlords, I don't know what kind of promotional materials that your previous staff in this role was able to develop, but we have a lot of success with one-pagers. I constantly use our one-pager for street outreach, because we get a lot of requests for street outreach services when really what someone wants is to make someone go away. So we can do a lot of education about what do we actually intend for the service to be used for. Here's what it can do, and here's when it's best to contact us versus law enforcement. And I think maybe just putting down some of those myths, some of those misconceptions, and the responses to them would be a lot of help.
I think that was one of my questions, is it sounds like you're going to complexes for recruitment. Are there other outreach efforts that have been going on?
Well, besides like I said, we have the quarterly meetings, and the previous landlord liaison would try to meet up with landlords, wherever their facilities were, and talk to them. Not really as far as any documentation that we're sending out, or any emailing list or anything like that.
Any of the landlord groups embraced you guys, allowed you to present, anything like that?
So we did do out there in the horse park, we did do a booth out there.
It's coming up again.
With the Central Kentucky, I think it was Central Kentucky Real Estate Rental something. So we did do that. So we had a booth out there, and anybody that came up, we would talk to them about the program or whatever. So we probably do that again.
Yeah, it's coming up.
And we've done events like at Duncan Park, when they had different organizations at the park that set up different booths. So we try to go out but again, we are the housing authority too. So it's not really just geared at this particular program, but of course we discuss that part of it too.
Yeah, the one, and you didn't hear this from me, if any of you go on there, but I hit them up constantly. I'll get on their site and say, hey, I've got somebody either in a wheelchair, they need, first floor access, and I've got a couple of people. It's called the Bluegrass Real Estate Investors Group. And then there's a whole bunch of other little groups like them, but I troll them all the time in case they're, because there are guys that go out and buy, houses, flip them, and then rent them.
And I honestly get calls like that, because I had a landlord just call me the other day, and he was like, so what are you looking for? What size unit you need? And, can you come out and do a pre-inspection if I get the units? So there's people out there who's trying to rent, it's just not as many as we would like.
We have a lot of options in this market, but Derek, definitely welcome aboard. Feel free to reach out. I'd love to chat with you sometime, a few minutes, just to let you know kind of what our original vision for the program is, see how things are going as you get acclimated, any ways that we can help.
Appreciate that, thank you.
And one last thing, because of this grant, the Housing Authority was also able to assist several more of our non-homeless new admissions households with our LHA grant. So that kind of gave us a little extra funds there, so that was great.
Thank you all for the presentation. Thanks everyone for all the good discussion today. I know we are getting very close to the end of our meeting time, so I want to make sure that everybody remembers to sign in on the sign-in sheet, particularly people that came in a little after we got started, so that we have your information for the minutes. And does anybody have any like very, very quick announcements for the group? Okay, since we are at the end of our agenda, I'm going to call us adjourned. Our next meeting is August 20th here in this room at 1:30.